I'm Will with Some of Change Productions.
They're at the back.
They're at the back. The Progressive press conference last week, the Progressive Caucus press conference, you touched on Progressive ceding single payer if and only if there's a public option.
Thank you.
And you touched briefly on why that's important for Progressives to do. Can you talk a little bit more about why it is important and why, for the Blue Dogs, why the compromises end at the public option?
Well, you know, it's hard for me to speak for where the Blue Dogs are going because a number of the provisions that they have proposed actually increase costs, and it's been, which is amazing for a group of members, frankly, who said that they want to decrease costs. What I can share with you, though, is that we are, out of Energy and Commerce, we got a commitment that we are going to get a standalone vote on single payer, which I think is important to set a marker. But we also cannot abandon the public option, so to take our eye off of that prize, because we run the risk of not being able to preserve anything going into our battle with the United States Senate.
Okay, and one last question. A lot of people talk about the demons of socialized medicine, and obviously we all know the military is on the government one option. Have the opponents of healthcare, has anyone proposed giving the military a better healthcare system, or do they think that the military gets the best healthcare we can buy?
No, I mean, I think that, I come from this experience because I grew up in the Air Force. I know the military system. I know that it works, and I also know that it's government provided. And so I always just share with people that for those people who are so against government being involved in healthcare, look at our military, look at our veterans, look at Medicare. So many of us actually are already engaged in government-provided healthcare.
But as far as you know, no opponents have suggested changing that. They don't think there's a better system for the military?
No. The military system is a good system, but it serves as a particular purpose. Whether that's something that we could then translate into the public sector is a different question altogether. And some of that has to do with just by the way that you provide service, just because of the contiguity of having everybody located on a duty station or something like that, that may or may not be appropriate for the broader public.
Okay, well, thank you.